Hi, my name is Greg Evans. I'm a pediatric dentist who practices in Fort Collins, Colorado. Your question is a good one and one that I answer frequently. Children fall into different categories for braces. There is a skeletal or a jaw growth category, and there is a simple dental or tooth crowding category. For the jaw growth category, about 30% of children are not going to grow, so the upper and lower jaws are going to grow normally. And in most cases, the upper jaw is going to outpace the lower jaw. There is a widespread debate right now in the dental literature about whether or not that particular child should be treated early or not. Some people think that if the upper jaw is growing faster than the lower jaw and there is the presence of crowding, early treatment with limited braces on the 4 front teeth and the back molars to push those molars where they need to be and unravel that crowding is going to be better than waiting until the end when a child is done growing. In this scenario, the first phase is done in about 12 to 18 months. Then all the braces are taken off and a child wears a nighttime retainer until the age of about 13 when all the permanent teeth come in, and then a second phase of braces is done in order to arrange all the teeth perfectly. This is called a 2-part or a phase 1, phase 2 braces, and it usually is very effective for getting an excellent smile. For a child that has an upper jaw that outpaces the lower jaw, but there is not significant crowding or other dental problems, sometimes it's easy to wait until all the permanent teeth are in and then to get compensation with the teeth for the difference in jaw growth all at one time. Generally speaking, that tends to shorten the overall time in braces, and the result is just as excellent. Some factors in choosing one or the other may be social. The parent may decide that braces at an early age to unravel crowding is going to make the child look better, whereas some parents may want their child to be more mature before they get ready for braces. Now the question is, in my mind, is an 8 or a 9-year-old that's enthusiastic and excited about braces going to be a better dental patient than a 13 or 14-year-old adolescent that wants to sleep in, does not want to brush their teeth, and does not pay much attention to mom and dad? The question is up to you, and again, we need to treat our patients individually. In about 1% of the cases, the lower jaw is going to outpace the growth of the upper jaw. This is called a class 3 growth. And in this instance, early treatment is going to be the best by far. A lot of times if that jaw outpaces the growth, you're going to get what's called an underbite, and that is not going to be able to be corrected later. So orthodontic treatment during the growth of the child, starting as early as age 4, 5, 6 years old, is going to help modify the growth of those jaws. The only alternative to modifying that growth is to let this child grow into adulthood and do surgery on the jaws. This is an expensive proposition and oftentimes does not give you a perfect result. So the best time for a child with an underbite to be screened by an orthodontist is probably earlier, 5 or 6 years old, and they may be in braces by 6 or 7. So that leaves the vast majority of the children, about 70% of the population, where the upper and lower jaws are growing exactly like they should. And in this case, what we look at is the extent of dental crowding. It is normal for a child in about the 2nd to 3rd grade to transition from the baby teeth to the permanent teeth with about 3 or 4 millimeters of crowding. And most good pediatric dentists are going to be able to help you mitigate that amount of crowding by manipulating the baby teeth. There's a few tricks up our sleeve that we have to help through this transition. For children that are more crowded, say 6 to 10 millimeters, oftentimes early treatment can unravel that crowding and set those teeth up so the rest of the teeth are able to come in a better alignment. In the cases where we've got early crowding and good jaw growth, sometimes early treatment will pay off and you will not have to have a second phase of braces later. On the other hand, if a child is moderately crowded but the aesthetics are acceptable, we can wait until the end when all the permanent teeth are in, again about 12, 13, 14, and do the braces all at once. The average time in braces is going to be at about 28 months, and that's the number that I put in my head to figure out, should we start early, should we wait, how is that going to affect their lifestyle, and how is that going to affect compliance. So that's it in a nutshell, but you'll find a wide range of opinions out there with orthodontists. And the other thing that you'll find is the type of braces and the type of styles that different orthodontists have is going to vary greatly. Orthodontics has made huge steps in the last 5 years in the technology of the braces, in the elasticity of the wires, and the ability to manipulate bone growth. It's a wide world out there, but again, when picking an orthodontist, get the advice of a good objective dentist, shop around a little bit, and then use your gut feeling. If you hear something that's too good to be true, it probably is. Hey, thanks for tuning in. If you have any more questions on this or would like more detail, please go to my website at www.biggrinswithdrgreg.com or email me. I love what I do, and I want to help you raise beautiful, healthy, happy children. Thanks.